So tonight we have two of our high fidelity simulators with us. So we have our baby simulator, and that baby's name is Luna. And Luna can do a multitude of things. So when our nursing students interact with Luna, they can check her respirations, they can assess whether or not she's going into respiratory distress, and even Luna can get what we call circumferential cyanosis, where she actually turns blue right around her mouth. We can check her pulse points, and even when the students are doing a full assessment on her, they will be able to see that she has intercostal and subcostal retractions, whereas just where the skin pulls in tight right around her rib cage. So they get a really good sense of what does it look like when a baby is going into respiratory distress, and how as a nurse do I identify that and then quickly be able to respond. So the other mannequin, she is one of our highest fidelity mannequins, and her name is Aria. She's actually a pediatric mannequin that can do a multitude of things that really help refine our nursing students' ability to do a full head to toe assessment on a patient. So if you were to look at her, you can assess her eyes. We can simulate that the patient is becoming jaundice by changing the sclera to a yellow tint. The students can also do a full neurologic assessment on her, where they can use a pen light and her eyes will actually react to the light. For a high fidelity mannequin, that's very impressive. She has heart sounds and lung sounds. Students can feel pulse points all over her body, just like they would in a real pediatric patient. And they also can check her peripheral pulses and look for her oxygenation levels. And so we take on that responsibility of educating the next generation of healthcare providers, and we do that through the advantage that we have with all of these technologies. We can immerse them in environments, right, that simulate the hospital setting to where they have patients that they can talk to them, they can assess their vitals, they can do complete head to toe assessments, and then we can help regulate all of that in a control room. They walk out with that next level of education that they need in order to care for patient populations that we're seeing in the hospital setting.